Hi, welcome everyone. My name is Michaela Reagan, and I am hosting today's seminar for the NNE-CTR. I'm a faculty scientist over in Maine Health, and right now I'm in Portland, Maine, but I'm originally from Vermont, and I study multiple myeloma. And I'm excited today to hear a different type of talk for my research, but Paige, it's really great to have you here. So our speaker today is Dr. Paige Brochu. She's the director of the Spatial Analysis Lab at UVM, and she's a research assistant professor in the Rubenstein School of the Environment and Natural Resources. She was originally at UVM for her undergrad, so she's an undergrad alum, and then she got her PhD and her master's from BU in Boston in the School of Public Health. And we're going to hear about her research today, which is focused on the intersection of human health and the environment using geospatial analysis and GIS to understand exposures and the impact on our communities. So Paige's work within the lab that we're going to hear about today is centered around GIS applications, specifically in translating this robust science into actionable data for our community's resilience. And this will probably be an increasing issue as pollution and global warming increases and our environment changes so quickly. So we are really interested to learn about your work today, Paige. It's great to have you here, and feel free to take it away.
Awesome. Yeah, thank you, Michaela, for the introduction. I'm really excited to be presenting today, specifically just because, I feel like I came upon GIS, and I'll talk about it a little later as well, just kind of out of the blue, my fourth year at UVM as an undergrad way back when, really trying to think about gaining like harder skills, right? Because I came from more of a theoretical, philosophical background. And then it really just translated into a complete career pivot, and then really was able to connect multiple different aspects of research and just interests that I was just really passionate about all together. So I'm just excited to really just share how great GIS, mapping, geography, geospatial analyses is with everyone today, and also just showcase, the resources that we have here at the Spatial Analysis Lab within the Rubenstein School of Environment and Natural Resources. And I also share my email at the end, and I can also share the slides too with everyone afterwards. So feel free to follow up with questions, put them in the chat, and I have about like 26 slides, so I probably won't be talking for the full hour, but I'm really excited also to take questions afterwards and really also just kind of hear what folks think or questions that you have that, maybe you never thought about connecting or answering these questions with GIS or mapping, and we can kind of get to, what's really truly out there and what's the full capacity of GIS and mapping. So very excited to kind of talk with you folks today, and I guess we can kind of get started through the whole, presentation slides. So like Michaela mentioned, I, was an undergrad here, graduated back in 2015, and I really began to explore geography and mapping really at the turn of my fourth year, like I mentioned. It was really my senior year. I was starting to kind of try to figure out where I wanted to go, what career I wanted to do. And my advisor at the time said, you need statistics and you need one other hard skill. And mapping came up and GIS. And I was like, oh, this really seems like a really cool kind of buzzword. What does this actually mean? So what I did was I took some GIS courses, and I really was actually interested in mapping to understand settlement patterns in the Caribbean because I was studying archaeology and biology at the time. And it was really interesting, right? I went on this archaeological dig. I wish I actually had photos of it. And we found these really cool post holds, which really just we were able to use GIS to figure out what were the housing structures in, prehistoric Caribbean settlements. So that was really great. But then I kind of was like, okay, so what else can I do with GIS besides just kind of put on points on a map using XY coordinates? What else can I actually do? So then what I did was I actually kind of dove a bit deeper into understanding spatial connections rather than, again, just using it for visualizing housing structures. So I graduated. That was all fun. And I actually began working at the Spatial Analysis Lab here as a technician. So I actually sat outside kind of in the bullpen area and really got started just circling trees and looking at, the built environment and the built landscape of the different communities that we do projects for. At the same time, I was also interning at the Vermont Department of Health. And so this was really where I saw this obvious connection of connecting health with the environment using GIS. And And so this was really where I got excited. I'm also really an avid outdoor adventurer. I love to be outside. So it really made sense to me that there's this connection between our health and the surrounding environment that we have outside. So to really, research this connection and build on all of the skills that I had as an undergrad, and then as I worked post grad, I then moved on to obtaining both my master's and PhD at the Boston University School of Public Health, where I was affiliated with both the Environmental Health Department and also the Earth and Environment Department through dual training with the NIH and NSF. So it was really trying to, build my interdisciplinary kind of skill set to then actually, do really great transdisciplinary and interdisciplinary research connecting two kind of different fields. So in Boston, I worked on a variety of different projects. I looked at COVID risk factors during kind of the initial pandemic that we had. I looked at drinking water contamination during natural disasters. But I was really actually, again, interested in looking at kind of the cumulative environment that we have just outside of our windows and that impact on health. So I'll kind of describe, where my true passion lies a little later on, but it's all really exciting stuff. I mean, as a researcher, right, we need to be excited about our research or else that's such a boring day. So honestly, throughout the past 10 years as a researcher, I've really been interested in this overarching theme of connecting health with the environment using GIS. So again, there's this need to kind of understand the distribution of our landscape to assist in creating more resilient and healthy communities. Like Michaela had mentioned, and I feel like a lot of us are well aware, the environment is changing. It's changing rapidly. Just here in New England, we've been experiencing way more flooding. We've experienced wildfire smoke exposure. And these are all things, again, that are part of our environment that impact our health. So really trying to capture, what's kind of going on with our landscape. What do our cities and communities look like? What's the infrastructure there? And then how can we create more resilient and healthy communities moving forward, since, we all kind of love the areas that we live in. So there's really a multitude of ways in which our environment can impact health. Examples here is air pollution can impact our respiratory health. It can exacerbate, underlying or pre-existing conditions. Heat exposure can also kind of impact our cardiovascular responses. It can cause kind of more strain on our cardiovascular kind of network. And then what is that? How does that necessarily impact, if again, we have these pre-existing conditions, or does this then lead to more at risk to develop these conditions? And also our community and where we live can also impact many different facets of our health, right? Do we feel safe in our communities? Do we have tree canopy that can alleviate that heat that I had just mentioned? And one way that we can really capture this environmental exposure is through GIS, or geographic information systems. So I'm just going to give a brief overview in case some folks are unfamiliar with GIS or mapping in general. So GIS, again, stands for Geographic Information Systems, and it's really a system of data, software, and tools that we can use to map and analyze different types of information. So GIS is really a specialized field, but there's many different uses of GIS in various industries. You've also most likely used GIS in your everyday life, right? So thinking about driving directions, having Google Maps up kind of in our car, or the good old days with just, whipping out that atlas of, all right, I'm now in New Hampshire and I'm in this town. So looking at, I would just remember those old map books, driving around, MapQuest, that was also kind of early GIS. You get a package delivered. They use GIS to track that package for you and let you know when it's been delivered. When we use our phone, when we want to again, check Google Maps, Apple Maps, what have you. So modern GIS, in a sense, really emphasizes this collaboration between both web and data access through the web using apps on phones and tablets, and just really the ability to share our work, your work, with anyone who has a web browser or access to the internet, right? So we create this great research, we create beautiful maps. How do we then get those maps to the audiences of interest, or the folks that are actually impacted by this exposure that we're capturing, or this accessibility question that we have? So also thinking about, where does this data come from, right? So I'm talking about how it's a system of data, but where is that data actually coming from? So it can come from satellites, So think, the satellite launches that we see coming out of, Cape Canaveral area, handheld GPS units, right? So like those classic little handhelds that we used to use back in the day. Our phones is definitely one thing. Planes that actually have sensors at the bottom of their planes to capture aerial imagery or elevation data to capture, the complex landscape of Vermont. Drones as well, which we have 25 active drones in the lab right now, which is exciting. And then if you ever want to come by and see our lab, it's not a big lab, but we do have all of our retired drones kind of hung up as decorations. But I digress. There's also underwater remote vehicles, which can help us map shorelines, can help us look for shipwrecks, debris, or even monitoring invasive species down in the lake. So there's a lot of different ways in which we can capture this data, and then I'll also show you a bunch of different ways that we can utilize this data. So one classic example about how we as health professionals have used GIS and mapping over the years is the classic John Snow cholera mapping example. I'm not sure who has heard of this before, but this was like front and center, I think, when I took my or when I TA'd for my GIS class in, the School of Public Health. It was like John Snow, founder of like modern epidemiology. That's a whole other topic there, but really understanding that John Snow basically used mapping to trace the source of a cholera outbreak in downtown London to a particular water pump. So it's the famous water pump here. There's also a pub, I think, on the other side of the street. So it's always fun. But, it really inspired officials to then change the way the water and wastewater systems operated in London. And again, this is, kind of historic GIS and mapping, but mapping in and itself is GIS. So John Snow kind of started the use of mapping and GIS, in the world of health professionals and epidemiology. But we can do a lot of really cool things with it. So you can map just about anything in the world. If you can find any sort of location data, you can map it and then, derive some results from it or visualize any sort of trend. So you can use a variety of different tools to actually map the data. There's different platforms out there. So we at UVM use Esri, which is a tool that requires a paid license. If you want to dabble with GIS, but you don't want to pay for a license, you can use QGIS, which is a free and open source download. There's also, Google Earth Engine, and Google Maps is also another easy way to kind of get started using GIS, or Google Earth was also another one. But you can map a variety of different health-related questions, right? So you could look at global COVID cases, looking at the start of the pandemic and then how it spread across the world. You could look at protected areas if we're really interested in biodiversity, and how that impacts our health and well-being when we see, a really healthy, thriving forest versus, a forest that's struggling and that doesn't necessarily have all of the fun species to look at and bird watch and all of that. You can look at it again to map outbreaks, monitor kind of vector activity, right? So thinking about climate change and changing environments that we're dealing with, you could also map ticks coming into the northern region, right? So the New England area, and thinking about, okay, so how does that necessarily, impact our healthcare network if we're now having more tick-related or vector-borne diseases and outbreaks? You can look at drive times to clinics if you're interested in accessible healthcare. Specifically, I'm working on this one project right now with the Planetary Health Initiative, and there's a proposal going in, and it's looking at accessibility and interruptions in radiation therapy during a disaster event, right? So Vermont and a lot of New England dealt with massive flooding, right, over the past 2 summers, and looking at road closures and how did those road closures then impact people's ability to get radiation therapy, which is not, something that someone at home can do telemedicine for. So again, like you can really utilize GIS to look at a lot of things. Another one is like route planning if you're looking for transporting medical supplies. And it's really important to take into account spatial relationships when we think about health, because it allows us as researchers to identify disease clusters using a hotspot analysis. So again, this is just actually using a hotspot analysis over John Snow's cholera map. And again, it really helps us identify, okay, so like this is where that pinpoint, that source pollution or that source disease outbreak came from. And then we can actually do interventions and actually take actionable steps to, alleviate that certain area. So when we kind of look at the surrounding environment as a whole, it really helps us understand that environmental influence on disease distribution. And like I had mentioned, target public health interventions. And without understanding kind of the spatial distribution of exposures and outcomes, we might be missing some underlying connections, or we might also be implying some other bias. One of the first rules of geography that we learn as mappers is Tobler's first law of geography. And this really states that everything is related to everything, but near things are actually potentially more related than distant things. So when we think of clustering, right? So going back to kind of John Snow's cholera map, you can kind of look at, okay, this is where it's clustering, then there's also clustering here, versus any sort of outbreak that's happening a little bit further away. So we can actually see Tobler's first law of geography in this map here, which is exciting. Like I mentioned, this might not hold true 100% of the time, but it allows us to look for clustering of similar characteristics when we use a mapping as a tool, and it then allows us to understand our environment and dive deeper once we've kind of identified certain clustering aspects. Now I'm going to give a quick little background about what we do at the Spatial Analysis Lab. For those who are unfamiliar, as you can see by our extremely formal logo, we take ourselves very seriously. And then once I go through this, I'll also talk about how we utilize the data that we produce here and the skills that we are training, our team of undergrads to then use for health implications. So the Spatial Analysis Lab, or the SAL, is what I'll probably be referring to it now further along in the presentation, is really where GIS started in Vermont. So over the past 40 years, we've worked alongside the U.S. Forest Services to develop tree canopy assessments and geospatial protocols that provides communities, nonprofits, government agencies, and others with usable information to make informed decisions about their green, gray, and blue infrastructure, basically about their whole community in itself. We take data and we figure out, how many trees do they have? What does their development look like? Are they developing more in one area versus another? And what are some health or other implications that we should be thinking about moving forward? One of the major, I would say, strengths of our lab is that we love the fact that we do a lot of experiential learning here. So we have a team of over, I would say on average, not over, on average, it's about 30 to 40 undergrads or recent graduate geospatial technicians, of which I was one of those at one point. And they're working on real world projects brought to us by communities near and far, right? So we've done work for the city of Burlington, which is where UVM is. And we've also done work in the Canada capital region, also in Hawaii. And, we're doing a project in Guam right now. We work with Puerto Rico. So our span is near and far, but we really work very closely with communities and have a big kind of community engagement section of our lab where communities come to us with real world problems, and we utilize GIS and the expertise that we have in-house to actually answer these questions. So we're really unique in this aspect, and it's one of the reasons why I love working here, why I came back as a postdoc back in May of 2023, because again, we're answering these real world questions that communities want to know, and we have that technical support to actually give to them. Another kind of aspect of our lab that makes us unique is that we're within academia, we're within university, but we function as a consulting firm in a sense where we have an income and expense kind of contract services, but then we also do big grant work. So we're also on NIH and SF grants. And we also operate kind of as a nonprofit. So there's various different ways in which we operate that makes us unique, that probably gives the business office headaches. But this kind of breadth of, or the range of which allows us to work, makes it so that we can work on big and small projects. So that way we can kind of leverage grants that we have to create new methodologies that we can then apply to small towns like Woodstock, Virginia, that is 3.5 square miles. And they had asked us to do kind of this, in-depth urban heat island analysis with the tree canopy change data that we produce for them. And they didn't necessarily have, tens of thousands of dollars to pay for that kind of research aspect of that project, but we were able to offset that cost by developing those methods in grant-funded research. So it really allows us to go from, looking at community aspects in a smaller, like kind of more local area, or, mapping the entire Chesapeake Bay watershed, which is, I don't know, like 90,000 square kilometers or miles, massive, right? So we can look locally or regionally. And then lastly, like I had mentioned, we have this really phenomenal drone team. And they do everything from emergency response. So they were really pivotal in the flood response that we had over the past 2 years. And we were also one of the first institutions within Vermont to actually have a drone that we were able to fly during Hurricane Irene. So we were able to really capture kind of the damage assessments after that had happened, which was, back in 2012. We also do other things as well. We have first responder trainings that we allow or that we put on for anyone within kind of region 1 of FEMA, which is all of New England, to come, understand what drones are. How do we utilize drones safely and effectively in an emergency response situation? We're also part of this larger kind of consortium with the FAA looking at drone protocols and safety kind of regulations around drones, right? Because drones are another hot topic like AI, like machine learning, but we want to safely be able to use drones, not unsafely. So we kind of span massive amounts of expertise here in the lab. And then I'll talk about, why the data that we produce is important and how does it actually, how can we actually use it to look at health issues? So the data that we produce in the lab can answer a variety of different health questions. This photo here, it's a sadder drone photo than the fun trees that I showed at the beginning, but this is showing the flooding in Montpelier, right, in 2023. So our drone imagery was actually used by FEMA to assess damages, and it actually sped up the damage assessment process by 4 weeks, which was compared to if FEMA actually needed to deploy ground assessors to actually look at the damage. So we were able to collect a bunch of different data and aerial imagery and flooding extent, which allowed folks, in Montpelier, in Plainfield, and Barrie, Berlin, all these other communities that were flooded, it allowed them to actually get that check from FEMA earlier rather than later to actually start rebuilding, right? And start replacing the things that they hold near and dear in their homes when those were destroyed. So our tree canopy also helps understand urban heat island profiles. So like I had mentioned, in Woodstock, Virginia, they were really interested, and they're a very small town. They were really interested in their urban heat island impacts. But they're not super urban. So when we went through and actually did this whole research analysis for them, we found that yes, there was an urban heat island, and we were able to basically give them recommendations on where they could initiate tree planting kind of programs to alleviate that urban heat island. So we've done that. We also can look at air pollution. So trees in the built environment can also impact air pollution exposure, either large particulate matter or traffic-related air pollutants or traps. So again, kind of thinking about the data that we produce, the tree canopy data, but also the land cover data that we produce as well, drones, what have you, how this can actually be utilized to kind of answer some really crucial health questions that we have today. Because all of these actually have impacted Burlington at some sense, or, the larger community of New England or of Vermont, if we think about it, right? We have now flooding. There is an urban heat island in Burlington and in other areas within New England. And then, like I had mentioned, we had that wildfire smoke exposure the other year, and that felt very apocalyptic, right? In a sense, where the air quality was so bad. So thinking about, are there nature-based solutions? Are there things in our built environment that could kind of point to interventions to alleviate some of these stresses that we have? And our UTCs are urban tree canopy assessments, and the other data that we produce for communities is really actionable data. So we love the fact that it's actually been used in the past to inform policy and drive initiatives. So our first iteration of mapping the entire New York City tree canopy was helped initiate the 2007 Million Tree New York City project, right? There was an announcement out of Cuyahoga County to invest $5 million in tree canopy based on the data that we had provided to them. And then Boston, back in 2022, we had produced a 2019 kind of data set for them. And Mayor Wu then announced, in 2022, that the city of Boston is going to invest in trees for cooling, flood reduction, and beauty. So again, we're trying to produce this actionable data that can be used in a variety of different ways, one of which is for health, but also just thinking about kind of the larger aspect and the goal of resilient communities. So other ways that we've integrated our data that we've developed in the SAL with health questions is also assessing how trees can alleviate harmful exposures, right? So air quality and traffic-related air pollutants or traps. Those are two things that some communities are really interested in. So for example, the city of Olympia in Washington state was interested in the possibility of understanding where they could plant trees to reduce air pollution exposure. So we basically mapped and gave recommendations for planting in areas that had really high annual traffic volume because they were really interested in traps. And so this was publicly available data that we were able to use. We also mapped this with the existing tree canopy layer that we provided to them, and then looked at the possible tree canopy. So these are areas of vegetation that are not tree canopy right now. Sorry, if you saw my lights go off, we are very energy efficient here in Aiken, but it doesn't think I work sometimes. So we also mapped, the possible tree canopy. So this is areas of vegetation that are not trees right now, but that could potentially be trees. So we basically gave them these three maps and they were able to, you look at, okay, so here in these areas over here, this dark purple, there's a large amount of traffic here, large amount of traffic volume. And there's also a higher possibility of more tree canopy being planted there. Granted, this isn't, thinking about what's underground or the actual mechanisms in which that it would take to plant trees. It just, again, gives them this broader, recommendation that then they can do with it what they would like with that contextual knowledge that they have on the ground in Olympia. So another kind of example is, we've used our tree canopy and we've looked at, again, urban heat island analyses. So for the city of Boston back in 2019, when we did I believe it was our first or second iteration of kind of looking at their landscape, we then looked at the average summertime temperature, which was calculated from land surface temperature, which is from satellites. And we created this kind of bivariate map. So it's basically comparing percent tree canopy in yellow here with the average summertime temperature in Fahrenheit. And again, this is not using high-level statistics. This is just a comparative of two continuous variables. And it basically shows the trend of in areas where there is really high tree canopy, so this darker yellow, there's less, or the average summertime temperature is lower compared to areas that have really high summertime temperatures and really low tree canopy. So you can kind of see in the downtown Boston area, low tree canopy, really high temperatures. Kind of as you move further outside of that downtown area, more tree canopy, lower temperatures. So again, it just allows folks to visualize these trends rather than just kind of, putting it in a report or showing it in a paper or a table, what have you, and then they can kind of go with it from there. So other kind of, other projects that we've done and been involved in the lab really spans across the board. So one thing that we've been actively working on is looking at the role of academic institutions in emergency response and preparedness to extreme weather events. So this is really looking at the Vermont 2023 summer floods. And initially we started working with the Vermont Department of Health to look at, what is some immediate data needs that they need that we could help day of that this was happening, right? Is it looking at where the flooding is by overlaying the drone imagery that we were able to capture? Is it also looking at flooding and drinking water contamination? Because that was also a big question. So the initial response was really the drone team, and then later on, we ended up getting a rapid response grant within UVM just to look at this immediate question of flooding and drinking water contamination. So I initially was leading that effort, and then actually two geospatial technicians within the lab, so they're recent graduates, they've actually really taken the lead on writing up this manuscript, interviewing folks, and figuring out, again, what's the role of academic institutions in an emergency response kind of effort when floods happen. So we now also have 2024 data that we can kind of utilize in this research as well. But again, it's really just looking at, okay, we have flood prediction modeling that is publicly available. We also can look at drone imagery to really capture where was the flooding extent actually happening, and then what private wells or what drinking water sources were contaminated, and how can we then better prepare for the next time it floods? Because sadly, I'd love to say we're not going to get another flood, but this year I think we flooded 1 year to the day of the 2023 floods. So it's not fun, right? But thinking again about the solutions. So we could spend all day talking about, why the flooding is the worst and all of the contamination and the impacts that it had on our health. We can definitely research that, but then we can also look to the future and try to figure out, with all of the amazing data that was captured during this, what are ways forward that we can prevent, contamination to drinking water, or at least prevent people going without drinking water for a few days or anything like that. So that's one kind of exciting project that we're doing right now. I'm also advising a current honors student in utilizing the tree canopy data that we developed for New York City back in 2017. We're in the works right now, actually finalizing our third iteration of New York City. So it's been this ongoing, really great relationship with them. However, before that project kind of finalized, we were already thinking about this research question. So it's really exciting to be able to advise a student in, connecting, again, the environment with health data using GIS, because again, that's like my tried and true passion. So I was really excited when this honor student asked if they could use, the tree canopy data that we created. Where can we figure out health data, demographic data, heat data? And so we're really kind of building out this cross-sectional ecological epi-study that they're going to be really, digging in the weeds for their honors thesis. And it's really looking at, first how the exposures and the outcomes are distributed across the census tracts in New York City, and then how these correlate with one another, not even necessarily thinking about the spatial relationships, and then really looking at that spatial relationship aspect, right? Because again, you can look at, you can look at something kind of in a multilinear regression or any other type of model, but if we're not necessarily taking into consideration where they actually are on a map, what are we potentially missing, or how does that change the relationship that we're seeing? So it's really exciting to see students utilize the data that they actually helped produce in a research fashion that they're going to, have full kind of autonomy over and independence to dive really deep into that research question. There's also other ways in which we can use kind of spatial analysis and GIS to look at health. So another way is actually I'm working with Dr. Deborah Kamen-Mukaz in the Larner College of Medicine here at UVM. And this is kind of a different take, right, on understanding kind of health implications when we're actually investigating the impact of different residential segregation indices on health research. So there's, again, a variety of ways in which we can classify or we can identify residential segregation. These are just kind of 3 examples, but there's a bunch. And it's really, then understanding if we classify residential segregation, let's say, as, absolute concentration, how does that then impact the way in which we see the health distribution of cardiovascular diseases in a population? Is that then different if we use a different segregation indice? So again, there's so many different ways in which GIS can connect health research with the environment or with kind of the research question that we're trying to answer. Another kind of study that we are currently in the works with is working with the Chan School of Public Health at Harvard, and the U.S. Forest Service. So we're looking at the impact of tree canopy change on health in this really great kind of longitudinal cohort. So it's the Nurses' Health Study. I'm not sure if folks are familiar with it, but I feel like I've been hearing about it for the past 10 years. And so I'm really excited to kind of get our hands dirty in that health data and really see, is there a link between the relationship in changing tree canopy, right, over time, because tree canopy isn't stagnant, it changes, developments happen, we, remove trees, we plant trees for other reasons. Is there a link between health and changing of tree canopy? So this is another really exciting kind of research question that, again, we're utilizing the data that we've created here. So there's over 50 data sets that we're utilizing for this study, and it's really exciting. There's also wildfire smoke exposure and pediatric asthma control. So this is a project that I'm working with the Gund Institute for the Environment here at UVM and the Larner College of Medicine. So it's a team of researchers led by a PhD student and also doctors and clinicians who are actually dealing with, on the ground pediatric asthma control. So this is not an image from the wildfire smoke in Vermont, but this is honestly how it felt at times in 2023 during, I also think it was during the month of July is when the worst wildfire smoke was, but it felt kind of apocalyptic, right? Like the sun was orange and you couldn't go outside without actually tasting smoke in the air. So you couldn't recreate, you couldn't be outside. So what did that implication have, or what does this exposure have on people when we think about pediatric asthma control? So kind of trying to solve this problem or look at this research in a spatial aspect when we want to actually estimate that wildfire smoke exposure. Sadly, we only have 5 active monitors across the state of Vermont that actually measures air quality. So how then can we accurately pinpoint, a patient that has asthma lives in zip code A, but they're like, 60 miles away from the closest active air monitor. So is that air monitor, reading actually accurate in capturing what they have or what their exposure is? So again, we can use a variety of different ways. We can look at spatial interpolation, which again takes into account that Tobler's first law of geography. We can also use a data fusion method, which takes into account the actual air monitor data. So utilizing that real world and real time data, but then also using satellite data and other kind of spatial statistic methods to create a more complete estimate. So that's kind of one of the questions that I'm a part of for this research group. And again, it's really exciting to work on different ways in which we can utilize GIS and actually answer these health questions. Here's a more pretty drone captured images of the beautiful fall foliage in Vermont. But there's other really exciting research that I'm truly passionate about, besides just the great stuff that we're doing here in the lab. So my calling always feels in the sense of looking at how nature and our exposure to nature actually impacts our health and well-being. So this is where my dissertation was. And this is where, when I think about my own kind of research nugget that I'm really excited about, that's kind of where this is. So again, even just looking at these images, right, I just feel less stressed and more happy. But there's really a variety of ways in which nature can kind of impact our health. So I'm just going to run through those real quick. Some notable examples are, mitigating harmful exposures such as heat and reducing flooding extent, like I've mentioned. There's improving air quality and lung health by removing pollutants, restoring mental capabilities and capacities such as reducing stress, like I mentioned, and restoring attention. So that can either be going outside for a walk, looking outside my window, having a plant in the office. There's many different ways in which to get that. And then also just encouraging kind of, beneficial activities and community engagement. So all of these pathways can impact health. It can impact it by lowering or reducing the risk of depression and mortality, improving self-perceived well-being, lowering BMI, improved birth outcomes, what have you. And so using GIS and mapping, there's really a broad way in which we can use these tools to assess the natural environment or to really try to capture exposures like I had mentioned. There's 3 common ways in which I'll kind of go through here Two others that I do want to mention is the use of wearables, right? So I have a Garmin watch. It tracks a lot of different things. It can track my heart rate, location, what have you. So you can also use wearables as a way to track kind of the location of participants in your cohort, if that's something that you have proposed, and it kind of goes through all of the levels of regulation that are needed. And then there's also elevation data and drone data that can be used to kind of assess nature and where folks are in kind of looking at it on a map, where they actually are via a location. So the three ways I'm going to talk about today are just remote sensing, which is data collected from satellites and aerial or airplanes, right? So this is just kind of satellite data here. This is from Landsat, so that's a satellite that's up in orbit right now. And this is just capturing the quantity of greenness or the reflection of chlorophyll in the Boston Commons area. So this is at 30-meter resolution, a little grainy, but you at least can get the gist of this is where the Boston Commons are. There's also land use data. So this is vector data. So this is polygons. And this is showing the different park polygons that are around the Boston Common area. There's also land cover data, which can be at various different resolutions. It can be at the 30-meter here, or the data that we produce in the lab goes down to 1 meter to half a foot resolution. And again, this really is just kind of the land cover data that just gives us an idea of what is it, right? So this is showing tree canopy, but if we were showing other types of land cover, we could see buildings, high development areas, low development areas, water, and what have you. But in that image, I was really just showcasing, one or the other for when we think about kind of estimating nature in one measure or multiple, right? Single measures of nature are really great when we think about, trying to create foundational manuscripts and research to really just get at one, greenness makes us happier, or greenness lowers our risk of early or premature death, right? But then are we actually missing kind of that full benefit or the consequence, right, of our environment if we're not looking at the full picture? Because I can look outside my window here, and anyone else can do that in the call, right, and see more than one type of nature outside, hopefully. Like I see, trees outside, I see the gardens on the Davis Center Green, and if I walk far enough away, I can see a view of the lake, right? So the maps here just showcase the same area. So that, again, this is the Boston Commons, but it shows different aspects of nature. So up here, this is just greenness. We have tree canopy, we have blue space, and we have parks. And all of these ways can impact our health in both positive and negative ways. So if we're just looking at just greenness or just access to blue space, my idea was that we are missing the full kind of impact of nature on our health. So one of the things that I'm really passionate about is actually looking for ways in which to capture the multidimensional exposure of nature in itself. And one way we can do that is by creating an index. So indices have been used in the past for public health and health studies in general, right? When we think about heat vulnerability, social vulnerability, what have you. And it's really a great way to better capture exposures and identify populations or areas for interventions when the exposure is not as straightforward as, dermal exposure to something that's in your hand lotion, right? So we can kind of think about creating an index for the cumulative aspect or for the cumulative exposure that we're interested in. And one of the ways that I did this was I created an index for this cumulative kind of nature landscape for Massachusetts, and I incorporated 3 different themes of nature into this. So I incorporated greenness, park and recreation proximity, and then blue space. And I can show a little bit of those results, but again, I just wanted to capture more than one way in which we are actually exposed to nature. So what I found in this research was that, incorporating multiple aspects of the natural environment, areas lacking in one kind of theme, right? So let me just orient us to this quick map right here. So in the larger map here, this is total nature. So this is incorporating all of the themes below. In the green map on the bottom left, we have greenness. The purple is showing park and recreation access, and then the blue is showing blue space. So that's, access to the Charles, access to the ocean, what have you. And so what I found was that areas lacking in one metric, so let's say greenness down here, still showed really high nature values. And so that means that even though people in these areas are not exposed to a lot of greenness, they still have a large exposure to nature in itself. And that was actually because they were close to like the esplanade along the Charles, and they were just, close to the Charles River and the ocean in itself. So they were still able to gain benefits from nature, regardless of the fact that maybe they didn't have really high trees. So again, what we found here was that there's this potential for exposure misclassification in our health studies if we're only attempting to use one or two measures of kind of nature of a type of exposure, when we actually are really interested in this more cumulative estimate. And maps can really help visualize this trend, right? So at the end of the day, we can utilize maps to really give context to audiences, right? So the map here on the left is showing land surface temperature, which is just temperature derived by satellite data. And it really just, again, is the surface temperature. So it's not what we feel or what we perceive or accounts for humidity, but it really just gives us a good estimate for temperature in general in the summer. And we can see here, right? So the kind of lighter yellow are lower temperatures, darker orange up here is really high temperatures. And we can see there's big swaths of land kind of in the middle of the Boston area that have really low temperatures. There's areas that have really high temperatures as well, especially in this kind of northwest arm. And then we can think about, well, what does this mean when we also take into account how nature, trees, blue space, grass, what have you, can alleviate some of that heat. And what we can see is that, areas that have higher nature, cumulative nature values, have lower values of heat, right? So in this map here, we're showing heat in light yellow to dark yellow, and then nature in light blue to dark blue. And as you kind of get darker on the color spectrum, it's just representing higher heat or higher nature in that area. And what you can see is that area that has really high heat, so that dark yellow has low nature. Areas that have high nature, this blue, have lower heat. So again, these are just really powerful visualizations that maps and GIS can provide for us to explain relationships seen in correlations in a way that's just easier to digest for the general audience. So that was it. Those are all kind of my slides. This is also another way nicer photo than the flooding photos that I had shown. This was taken this year actually by our UAS team, just showing how the beautiful first snow on Mount Mansfield. But with that, I'd love to open up to questions, comments, a discussion. I actually talked for way longer than I meant to, so I apologize for that. But yeah, honestly, in the end, GIS is just really this great tool that can connect multiple different fields, showcase trends, and really kind of get at what does it mean to be in a certain location impacted by our environment. So thank you for listening.
Thank you so much. That was
Yeah.
a wonderful talk. Gary, you can go first, but also everyone feel free to put questions in the chat if you'd like, or raise your hand in person or virtually. Go for it. Thanks, Gary.
Paige, so those are very powerful tools that you described. I mean, that was a very, very accessible presentation. When you were discussing a series of natural parameters that were being evaluated in terms of their impact on a lot of types of social and health issues, what about white space? Does that, I mean, how does that factor in? Because that certainly is going to go ahead and to occur during a certain, component of the year, and we're approaching that right now.
Yes. Okay. So that is a question. Seasonality was not taken into account at all when I was creating that index, right? Which is a huge limitation to that, in the sense of, some people think snow is really beautiful. Maybe snow is a little bit more, or the winter aesthetic that we get from nature, right? Where things are frozen over, that might be a completely different benefit or consequence of the natural features if we think about it. I would say that and introducing seasonality is a whole other, like that is something that I'm really interested in, especially when we, like, I mean, we're all New England, right? So we have that seasonality. In the fall, trees are beautiful. During stick season, they're just gray. They're just sad. And so are we actually getting the same benefit year round from these different natural aspects? My gut is telling me no, but I haven't researched it yet, so I can't put that in writing.
Well, in terms of messaging, Currier and
Hmm.
Ives really capitalized on snow, and
Yep.
it's kind of interesting. So, I mean, so that may be something. I have
Hmm.
one other question,
Yeah.
and that is, to what extent can you utilize the GIS tools retrospectively? And the reason I'm asking that question
Hmm.
is when you look at health and healthcare, if you turn the clock back 15 years, and then start heading towards the 15 to 10-year period, we were making tremendous progress in terms of the prevention, early detection, treatment, and survivorship of chronic disease.
Hmm.
Then we hit the pandemic and everything pivoted to survival from COVID. So
Yep.
now what we are up against is what are some of the most effective strategies to restore that momentum in those key areas? And I can't help but believe that understanding access, understanding, what facilitates and what obstacles there are would be very important. But can we go back to data and try to go ahead and retrospectively assemble what some of the obstacles and opportunities are?
Yeah. So honestly, as long as the data exists and you trust the data, right? Because it's really also important to understand how that data was created.
I come
Um,
from Brooklyn. It's
we
Dater,
Yeah, we can
DATER.
map it, right? So luckily there's a lot of different publicly available resources out there as well that show different administrative boundaries over time, road networks, what have you. And if you had that data available and like had the question, you're like, okay, I wanted to look at the changes in healthcare networks or the reach of healthcare networks, and then how that accessibility of those healthcare networks changed the survival rate or the treatment rate of, outcome X. As long as you have that data, we can run those analyses, right? So we can actually look at how many folks were actually kind of in the network of a facility, and then what's that relationship with maybe those positives or negatives that we're finding for those outcomes. So honestly, as long as the data is there, and we could take that conversation offline if you want to talk about ways in which our lab could really help with that. Because again, like that's the fun research that I'm like, let's figure that out, right? Because like you had mentioned, after moving away from the pandemic, knowing that now it's here to stay, we're going to just like kind of live with it and adapt. How can we continue that momentum on some other health outcomes and some other treatments that were really beneficial pre-2020?
We will follow it up.
Yes, I love that.
Go ahead, Maria. Go for it.
Yeah, awesome. Wonderful talk. My name is Maria Bravo. I'm in the Department of Pathology and Laboratory Medicine. And I had a question for you, kind of related to these health outcomes. What's kind of the minimum density of, say, health outcomes that you need in an area to
Yeah.
kind of be able to kind of make these types of predictions or see whether there's correlations or relationships between certain things?
Mhm.
Because I'm thinking about, I know pathology has this one study. It's 30,000 participants across the country.
Mhm.
Some places it's one person.
Yeah,
And
so
so,
I think you run into the same. So spatial statistics kind of runs into the same limitations, right? That just general traditional statistics has. So if we're looking at, like cluster analysis, like I had shown, kind of using like the John Snow cholera example, um, that needs a minimum of like 30 observations in a particular area to actually come up with some sort of clustering representation, right? And there's always these limitations when we use any type of statistics. Are the assumptions met? What have you? I've also kind of run into the issue of lack of data sometimes, specifically with health data, because one, it's protected. So either you have to have access to a cohort or you use publicly available. So I use a lot of CDC Wonder data or the CDC Places data. It's good. It's not great, right? And if there's less than 9, deaths in a certain county, then it's not even counted, right? So that county just doesn't exist in the data set anymore. So yeah, it's really, I would say it's research question dependent, and then what statistic that you want to run. But I'm happy to definitely like follow up with any questions. If you have a particular kind of idea of a way to visualize the data using a map, and you're like, can we do this? Definitely feel free to reach out, and I'm happy to kind of continue that conversation.
Paige, I have some questions, but can you see the chat?
I don't have, yeah, I can open it real quick. Sorry.
Okay, the last one is a pretty interesting question.
Let's see. So, have you faced any specific barriers in translating geospatial concepts like you've shown to us today to healthcare stakeholders, and how you've managed to overcome them? Yeah, so I think I would say that the majority of the presentations I've given and the audience that I've presented to have always been familiar with GIS. The only time in which I've encountered confusion or what have you was actually one of my first kind of grad school presentations, where I was showing the range of greenness, like distribution range, right, across the entire US. And it was really hard for folks to grapple with how my study was looking only at greenness, but areas of the US are not green. So it's like I was missing an entire population of my study because, in the Southwest, nature just looks differently, right? So that was actually one of the reasons why I was really excited for later research and my ongoing research now to look at nature more cumulatively. Because I feel like we can look outside and it looks different to everyone, right? So I feel like that's really the only instance in which I've kind of struggled with contextualizing and showcasing a map, and then folks have not necessarily understood kind of where I'm going with that. But it was a really kind of good back and forth questioning for one of my first presentations to be like, oh, you're right, like this actually doesn't make sense. So now let's reframe this, right, in a way that's actually realistic and kind of makes more sense to a broader audience. I would say, I don't know. Yeah, I feel like that's my only really experience there. I think healthcare stakeholders in general, if you can relate it back to where they are, right? So if you can showcase the map of where they are, I feel like people are much more, they're like, okay, now I get it. Or they might say, that's not what I perceive. And then it's really important to also just understand that like perception is also everything. So I apologize, I haven't dealt with that as much, but one day, as I give more of these presentations, right?
Let's go with Matt. If you're there, Matt.
Yeah, if I can unmute. Okay, now get my video going so I can actually be polite. I have way more than 2 minutes of questions. I wrote a whole bunch of notes down. That was such a nice.
Oh, I love it.
Just a comment. Well, two things that maybe you comment on. You mentioned the flooding and the effect of water, the effect on water systems. I did a lot of volunteering, and I saw how much crap ends up in the watershed, and just for everything, oil tanks and appliances and paint and insecticides. And it'd be really, this leads to my next comment, visually compelling to have some sort of a map of that kind of thing. And what really struck me is it was so educational. This is really visual storytelling. I mean, we're not, as far as I know, there's no connection between humans and birds in our genetic history, but we really respond to those sort of overhead views, and you were conveying so much information. So, I guess, yeah, what is that, the sort of the creative storytelling aspect of it? What does that have to do with how you think about your work?
Yeah, I think at the end of the day, similar to the previous question, right? It's like relaying and being able to relate the data that we're showing back to the people in the audience. I feel like it's really important. It's like, I can utilize the data in any aspect that we necessarily want to answer my research questions, but how is the data actually going to get the most impact and actually be utilized by these communities, by these folks? And it's really by connecting it back with them, right? So it's the storytelling. So there's actually a lot of really great tools I didn't even show. There's story maps on ArcGIS Online. There's a bunch of really cool resources that allow folks who are way more visually in tune. So I'm public health, right? Notoriously not great at visualizations. At least that's the way I identify myself. But, you know, there's really wonderful ways in which we can showcase all of this data in, like you had mentioned, storytell. So get to utilizing this great data, but actually impacting and telling it in a way that's really accessible to other folks, I feel like is key. So it's all about science communication, right? Because at the end of the day, I can say, you know, trees decrease surface temperature in Boston by 1.3 degrees Celsius, but like, what does that mean to a Boston resident who lives in an area that doesn't have a lot of tree canopy? So a way in which to kind of tell that story, I think, is really important. Thank you. And again, I can share my email in the chat, and then I can also share my slides as well. So if anyone has any questions, follow-ups, what have you, feel free to email me.
I think I'll do that since it's past one. Thank you so much, Paige. Thank you all for coming, Sheila, and the CTR for hosting. And check the chat. In 2 weeks, there's going to be one final fall seminar presentation. Hopefully, see you there.
Awesome. Thank you, everyone.
Thank you, Paige. It was great.
It really
Thank
was formative, very much so.
Yeah.
Awesome. Have a great Friday.
Thanks.
Bye. Enjoy your weekend.
Saturday and Sunday too, enjoy.